Hello, welcome to Book of Erica. This is where we discuss all things bariatric surgery, pre-op, post-op, and life after complications. My name is Erica. I'm a nearly 12-year veteran of the gastric bypass surgery, and I'm not a medical professional, but my goal here is to share my journey with you so that you can go into yours knowing a little bit more than I did going into mine. Welcome. If you want this type of content and it interests you, go ahead and hit that subscribe button and the bell notification so that you can know whenever I upload a new video. Today, we're going to talk about calcium. It's one of those buzzwords that you hear about after surgery, and it is vital to your success and to staying healthy in the long run. So let's talk about why it's important, some things that you might want to consider when you're picking out your supplement, and we'll talk about what it is that I'm taking 12 years out. I noticed that online, lots of people are looking up why is calcium important after bariatric surgery. I want to flip that question on its head a little bit and ask you, how important are your bones and your teeth? Okay, because the reality is we have to take calcium supplements because we're not going to absorb as much, especially if you're a gastric bypass person. You're just not going to absorb it as well, and you need it. Okay, and you need to make sure that it's the right type. It's vital that it is the right type. Taking the supplement every day and meeting, sorry if you can hear my dog walking around, meeting those minimum standards that your surgeon's office is going to set is going to keep you from developing osteoporosis at a very young age. And here's the news flash: you may still develop osteoporosis even if you're taking the calcium. So do what you can to prevent that. So what you should look for in a vitamin. Your dietitian in your surgeon's practice is going to supply you with what their recommendations are for the minimum requirements for your supplement. Go with that. Okay? Don't research it on the internet. Don't look it up on Google. Go with what they tell you, because what they tell you is based on the current research that is out there. So you're not going to find anything better, and you might be finding stuff that is a decade old that may be giving you incorrect information. So go with what they tell you. I recommend finding something that it even exceeds just barely what the standards are that they give you. This may require a lot of research on your part, and it's probably not going to be available at your local grocery store if you want to get something that's going to be the best for a bariatric patient. There are a couple of different types of calcium out there that you can buy if you're going to your local grocery store. You have calcium carbonate, which would be, an example would be Viactive Chews. Okay, and whenever I first was looking at the surgery, I thought, hey, that's what I'm going to take because that's going to look like candy and I can take that. Do not at all take Viactive as your calcium supplement. As a bariatric patient, what you need is calcium citrate, not calcium carbonate. How do you know that your calcium is calcium citrate? Remember that video that I did that asked you if you're going to read the labels on everything? You have to read the label. And the very first ingredient, if I can get up here, I don't know if it'll, if I take myself out, will it focus? There we go. Calcium citrate. It really is that simple. If you look at the ingredient list on Viactive, it's going to say calcium carbonate. Your body is not going to digest that. It doesn't go into the right parts and meet the right juices and all of that stuff to break it down so that your body can absorb it. This one is much quicker to absorb, and Citracal is an example of a brand that is calcium citrate. So if you're going to Walmart and that's what you're looking for, Citracal is what you want instead of Caltrate is an example. So you want Citracal instead of Caltrate. As with all of the supplements that we take, chewables or liquids are always the best. You're going to absorb those better. Most of the pre-digestive stuff is done for you. So if you can afford it and you can find it in one of those forms, go with that. If you can't afford it, affording it is why I have these, but increasing the number of pills that you have to put into your pouch in your digestive tract is going to irritate it. It may cause you pain. It may make you very uncomfortable. So if you can afford it, definitely go chewable. I've already shown you what I use, but I started out using chewables. I started out with Bariatric Advantage soft chews. They were wonderful. Okay, I'm going to give you that. They were real similar to a Tootsie Roll. I think I've got a video where I tried those, and I will try to link it in the cards if I can find it. They were nice, but they're expensive, y'all, like real expensive. And life happened. I was in and out of the hospital a whole lot. Didn't get to work for a year. You know, I mean, it was what it was, and I had to stop taking those. And when that happened, I went for a little bit and didn't get calcium in. And now I have the bones of a 60-year-old woman. I'm not 60, okay? So it is vital that you take your calcium every day. Every day. If you can't afford the fancy bariatric stuff, something is better than nothing, okay? Something is much better than nothing. For the last decade, I have used Citrate Petites, specifically the Walmart brand of Citrate Petites. In the last year, they have changed. They've changed their product. They are not so petite anymore. They used to be small. These things now are like an antibiotic. They're huge. And to actually get in what I should get in, I'd have to take 10 of these a day. And I just can't. And they make me nauseous. I don't know what they changed about them when they changed their shape, but now they make me nauseous. And I'm trying to avoid them. So I will be looking for something different. But that is what I've taken for the last decade. Now, I have placed an order for a new calcium supplement, and when it comes in, I'll be sure to do a review of that for you so that you can see it and kind of see where it goes, how it tastes, that kind of thing. But that's where I'm at for right now. So the high points of the calcium discussion are: it is vital, make sure you do it, your bones and teeth are important, we want to smile, right? And we don't want to trip and break something. I am not about being a 30-something-year-old that says, I've fallen and I can't get up. Okay? So make sure that you are meeting or exceeding your surgeon's program's minimum requirements. Make sure that it is calcium citrate and not calcium carbonate. And make sure that you find a supplement that does not make you sick so that you're not avoiding it, because you really need to make sure that you're on it every day. If you start this before surgery, you can build up reserves so that when your body starts eating things, you're not as bad off, okay? So it's not going to hurt you to start this pre-operatively to set you up for success later. Now, my question of the day is, what is your favorite calcium supplement? Go ahead and leave that in the comment box below. It might help somebody else as they're trying to research what they're going to take. Okay? And I will see you all next week. Bye.